Alright guys, so this is going to be a very rapid fire exam 1 lab review hitting the most high yield topics that you may expect to see on your lab practicals. And this is being brought to you by the Scrubs team, which again stands for the Student Collaborative Resources for Understanding and Birdie Success. Alright, and for our mission statement, as I'm sure you've seen many a times, Scrubs is a student-driven initiative that aims to develop supplemental resources for current and future cohorts that will pass through Birdie. Members of Scrubs participate in a variety of subcommittees working to create resources for students, by students, with the aim of offering you perspective of a student who's gone through the course ourselves. The hope is that this will eventually become a staple of the Birdie student body and exemplify our unique collaborative community. Now, as a disclaimer, these resources are made by students, not by faculty, so there is the potential for error, although we do our best to minimize this whenever possible. Additionally, Scrubs is a supplemental resource and does not take the place of instruction by the Birdie faculty. So with that, let's get into this high-yield anatomy lab review for exam 1. Okay, this may look extremely shocking at first glance. This is a list of all the structures that I would anticipate you to be tested on in the lab. So any one of these structures could be tagged and could be a question on the lab exam. And this may not be a comprehensive list, but it should include almost all the structures you may expect to see. So if you go through this list and you feel like you can identify each of these structures confidently, then you're probably in pretty good shape for this lab exam. The one in red, any of them that are in red are things that I think are more likely to be tagged, either due to their special relationship or due to their specific structure that has a good second order question that can be asked in the lab exam. So the ones in red are ones that I would make sure to know. Okay, so this is just a quick review. I'm not going to go through all of these, but these are things that you can look back on in your studies. Now, as we move forward, we're going to go through a couple of images and talk about a couple of structures. We are not going to cover everything. We are not going to cover most things. We're just going to cover a few things that I think are most important to know as you're prepping for the exam. Okay, let's start in the back. We're going to identify two muscles very quickly, and I apologize, this video is going to go very fast. This is meant for rapid fire, fast yield review. So this first one is going to be our trapezius. Okay, remember that our trapezius is innervated by our accessory nerve, that is cranial nerve 11. It's important for all of these that I'm showing you that you ask yourself a couple of questions of this muscle. Ask what nerve innervates it, and ask where the spinal segments that are associated with that nerve. It may also be good to know the origins, insertions, and actions of a muscle, just because those are easy second-order questions to get. The next is the lat dorsi. The lat dorsi is coming up here, going into the anterior portion of the arm. The lat dorsi, remember that it's innervated by the thoracodorsal nerve, spinal segment C6 through C8. Okay, as we're going forward, again, we see the lat dorsi over here on the lateral aspect of the thorax. This is, again, innervated by spinal segment C6 through C8 via the thoracodorsal nerve. Then if we look more medial, we're going to now see our rector spinae group. Our rector spinae group consists of the iliocostalis most laterally, the longissimus more medially, and then the most medial up against the spine is the spinalis. Now I want to point out in this particular image we can see part of the shoulder, and that means we can see some of the shoulder musculature. The first one, this big muscle down here, is our teres major. Above it is the teres minor. Right here is going to be the long head of the triceps, and that means that we're going to be forming a space right here. Right, remember the spaces, those are going to be really important. This is going to be our triangular space right here, and that means that if we see something running through the triangular space, we know that it has to be the circumflex scapular artery. Right, then up here we can see our infraspinatus right above our teres minor right here. Again, these muscles, infraspinatus is innervated by the suprascapular nerve. Suprascapular nerve has spinal segments C5 and 6. We have the teres minor innervated by the axillary nerve, spinal segment C5 and 6 again. And then right here we have the teres major. Teres major is innervated by the lower subscapular nerve, spinal segment C5 and 6. So all of these have the same spinal segment, C5 and C6. Okay, some important things to know when you're looking at the back. If you're looking back here in the spinal cord, we have the dura mater covering the spinal cord. We go deep to the dura and we're going to get the arachnoid. We go deep to that and we're going to get the pia. Now, back here in the back, some things that I want to point out is we can see the actual spinal nerves coming off of the spinal cord. So the spinal nerve is located here. You see this bump back here in the back. This is on the dorsal root. The bump on the dorsal root is going to indicate the dorsal root ganglion. Right, this is going to be the cell bodies for the pseudounipolar neurons that are located in the dorsal root. So that's your sensory information. And then right here we can see the spinal cord or spinal nerve itself coming out. And then you're going to have a ventral and a dorsal component. Okay, the dorsal component is going to do some of the intrinsic muscles of the back. The anterior rami is going to do most of the rest of the musculature. Okay, that's everything for this image. Now on this second image I want to show, we've opened up the spinal cord, we've cut through the dura, we can see the pia mater overlying the spinal cord here. We're looking at a pretty inferior view of the spinal cord. So you see these fibers that are coming down. These are going to be rootlets that are going to form spinal nerves. This is going to be your cauda equina. So the cauda equina exists because the spinal cord ends at the level of L2, but you have spinal cord segments that spinal nerves that need to exit through lower layers of the spinal cord, the vertebral column. So here is the spinal cord here. You see that it is ending. Where it ends, that is called our conus medullaris. So the conus medullaris is the end of the spinal cord. That happens at the level of L2. If we're doing a lumbar puncture, we want to go between the level of L2 and the level down here somewhere around L4. Okay. Now, what is this fiber that is running all the way down? This fiber right here is going to be our filum terminale. This is an extension of the pia mater. Important to note, it is an extension of the pia mater. Something that we can't really see very well here, but we have denticulate ligaments. Denticulate ligaments are coming out laterally and attaching to the vertebrae. This again is an extension of the pia mater as well. So the pia mater is doing all of your support. So the filum terminale keeping the spinal cord in place inferiorly, and the denticulate ligaments keeping the spinal cord attached to the vertebrae laterally. Okay, now we're looking a little bit more in the back. So we've gone deep to the trapezius. The trapezius muscle is reflected here. Again, remember trapezius is innervated by the spinal accessory nerve, cranial nerve 11. Now that we're looking more in the midline, right here inferiorly, we're going to have our rhomboid major. Right above that is our rhomboid minor. And then right here, we are going to have our levator scapulae. So these muscles are all innervated by the dorsal scapular nerve. Dorsal scapular nerve innervates 1, 2, 3 muscles located right here. So if we see a nerve coming down in this region, it's going to be the dorsal scapular nerve. Dorsal scapular nerve has spinal segment C5. Okay, so rhomboid major, rhomboid minor, levator scapulae. We mentioned the trapezius was reflected, and I want to point out that right here is our scapular spine. It's a little bit difficult to see, but the muscle that's located just superior to the scapular spine is our supraspinatus. The one located inferior to the scapular spine is our infraspinatus muscle. Both of those are innervated by the suprascapular nerve, spinal segment C5 and C6. Okay, now we're getting into more of the shoulder. So we're going to label some of these muscles here. Let's start out down here at the bottom with the teres major. So teres major, again, innervated by the lower subscapular nerve, spinal segment C5 and 6. Now we have the teres minor, innervated by the axillary nerve, which also innervates the deltoid. We can actually see that nerve coming through right here as it's piercing the deltoid. So it hits the teres minor and the deltoid muscle, spinal segment C5 and C6. Right above the teres minor, we're going to have the infraspinatus. There goes our scapular spine right there that we can see. So the infraspinatus below the scapular spine, supraspinatus above the scapular spine. Both of these muscles are innervated by the suprascapular nerve, which has spinal segments C5 and C6 as well. All right, right here we have our long head of the bicep. Long head of the bicep coming through right here, innervated by the radial nerve. And then here is our lateral head of the bicep. And then deep to that, we'll be able to see our humerus if we dug in here a little bit more. What I want to point out while we're in this region is that this is where it's really important to know your spaces and intervals. So if you remember, this is your triangular space. It is bordered by the teres minor, the teres major, and the lateral head, the long head of the triceps. So that forms this triangle right here. So there goes your borders. In that space, you are going to have one structure you need to know. That is going to be the circumflex scapular artery. So the circumflex scapular artery runs through the triangular space. Up here, we have our quadrangular space. Quadrangular space is bordered by the teres minor, the long head of the triceps, teres major below, and then the humerus or the lateral head of the triceps more laterally. So that forms 1, 2, 3, 4 borders. That gives you your quadrangular space. And in this space, you have a vessel and a nerve pair that run together. The nerve that runs through this space is the axillary nerve, which we can actually see here piercing the deltoid. And then here we can see the vessel underneath. This is our posterior circumflex humeral artery. So make sure you know your spaces and the associated vasculature. And then if we dug up in this region, this will be our triangular interval. So border on the top being our teres major, medial border being our long head of the triceps, lateral border the lateral head of the triceps. In between, that's where we're going to get our radial nerve and our profunda-brachial artery. All right, and then pointing out down here, we have a little bit of the lat dorsi that we can see as well. Okay, now moving to the anterior portion of the body, we're looking at the pec major, and we can see the deltoid up here over top of the shoulder. Here goes our clavicle. What I want to point out here is that we have a vessel that's running in between the deltoid and the pec, and it's coming around and through. This is going to be your cephalic vein. So your cephalic vein running right here, something you may expect to be tagged on the exam. We can also see a little bit of the bicep here. What I want to point out is just under the pec, we're seeing fibers that are coming laterally. This is part of your serratus anterior. If we look, we have a nerve that's running down to hit the serratus anterior. This is your long thoracic nerve, spinal segment C5 through C7. In this image, we've reflected the pec, so the pec is now being reflected back, so this is the pec major. That means that the pec minor is underneath. What I want to point out here is something that is very important for you to know, the difference between the medial pectoral nerve and the lateral pectoral nerve. The lateral pectoral nerve just innervates the pec major, so it's this nerve right here. It does not go through the pec minor. Once again, the lateral pectoral nerve does not go through the pec minor. So here goes your lateral pectoral nerve. Medial pectoral nerve does go through pec minor. So here's pec minor, here's your your medial pectoral nerve, piercing pec minor, and going into pec major. Okay, so that's how you tell medial versus lateral. It's important to note that you can only tell the difference by looking if does it pierce the pec minor. Because if you try to do this in anatomical relationship, you can actually see that the lateral pectoral nerve, when it's hitting the pec, is actually more medially located than the medial pectoral nerve. So it's important that you look at does it pierce the pec minor to answer this question. Other thing I want to point out, right here we can see our thoracoacromial trunk. We know it's the thoracoacromial trunk because as it's coming off the axillary artery, we can see that it's giving off a bunch of branches. This is going to give off 4 branches. These are your DPAC vessels. That's the deltoid, pectoral, acromial, and clavicular branches of your thoracoacromial artery. Other things to point out here, we have our cephalic vein, which is, again, we saw in the previous image. It's now coming down, and we can see it coming down and joining with a bigger vessel. Okay. So this larger vessel here is your subclavian. This is your subclavian vein. All right, right here is the axillary vein. So when the cephalic vein and the axillary vein come together right at this juncture, then you have the subclavian vessel. That's how you tell the difference. All right. Now, moving into probably the most difficult portion of identification. For most students, this is the axilla. We're going to go through these 2 images relatively quick. I apologize, we'll not hit everything, but we're going to try to hit most of the vessels and most of the nerves. Unfortunately, we just can't see everything from these 2 images based on how they are viewed. So let's start with the vasculature. What I want to point out here is the axillary artery is going to be running through this region, just deep to this the nervous tissue. Remember the anterior cords, anterior divisions of the spinal cord are going to run on top of the artery, so the artery is going to be a little bit occluded here, but we're going to do our best. The first thing I want to point out is this vessel here. This vessel comes out, and we can see that as branching. It's giving off a total of 4 branches. Even though we can't see each one individually in this image, that tells me that this is the thoracoacromial trunk. The thoracoacromial trunk, again, giving off those DPAC vessels. The next vessel that comes off the axillary artery next to the thoracoacromial trunk runs down along the thorax. Because it's coming beside the thoracoacromial trunk and it's going down along the thorax, I can identify this as a segment of our branch of our second segment of the axillary artery, as the axillary artery is underneath the pec minor, and the pec minor is actually reflected up here. This is going to be our lateral thoracic artery. So our lateral thoracic artery coming down on the lateral aspect of the thorax. I want to point out that this runs with a nerve. It runs with this nerve right here. This is your long thoracic nerve. Your long thoracic nerve is going to be innervating the serratus anterior, which is located right here. So long thoracic nerve has spinal segment C5 through C7, right? And it runs along with the lateral thoracic artery. Okay. Now, we can't really see most of the other vessels as they're coming off distally. We'll try to see that in the next image, but I do want to point out some things that we can see here. We can see our M. This is the anterior terminal branches, or the terminal branches off the anterior cord, or anterior division. You're going to have the musculocutaneous nerve right here. And we know this definitively because it's piercing a muscle, and that muscle is the coracobrachialis. Important to know that relationship. The coracobrachialis is pierced by the musculocutaneous nerve, and vice versa. Here we have the median nerve. It is coming off of components of the medial cord and the lateral cord, lateral cord up here, medial cord down here, forming that M, and that forms the median nerve, which has all spinal segments, C5 through T1, all spinal segments that are made up in the brachial plexus. Now, most inferiorly, we are going to have the ulnar nerve. The ulnar nerve is going to come down. Spinal segment C8 through T1 comes off that medial cord. Okay. Now, some other things that we can vaguely see in this image, we can probably see it better on the image on the right, which we'll review in just a moment. I want to point out that coming down here, there's a nerve, and it is going down here towards the latissimus dorsi. If there is a nerve coming down toward the latissimus dorsi, then we are going to call that the thoracodorsal nerve. That is going to have spinal segment C6 through C8 coming off the posterior cord. Now, there is a vessel that's running along with it. If there's a vessel that's running along with your thoracodorsal nerve, then that is going to be your thoracodorsal artery. All right, image over here on the right. Same thing, start with the M. We're going to say musculocutaneous nerve, median nerve, and then ulnar nerve, okay, coming down and around. What I want to point out here is we can see this is part of our second segment. Our thoracoacromial trunk is here. The vessel that comes off next and runs down the thorax is your lateral thoracic artery. There is a nerve that runs along with it. That is your long thoracic nerve. Has spinal segments C5 through C7. All right. Now, a little bit more difficult to see, but we're going to do our best. If we come around here posteriorly, this is a artery. This artery is coming off of the axillary artery, and I'm going to tell you that it is going towards the scapula, and it is going to be your subscapular artery. The subscapular artery is then going to bifurcate and form the thoracodorsal artery, and then a circumflex scapular artery. Remember, the circumflex scapular artery runs through a space we've already reviewed. It is going to be running through your triangular space. Okay. As we get into the arm and forearm, there is way more than we can review. So we're going to skip most of the musculature, and we're going to focus on the nerves and the vessels. All right, so let's start with following the brachial artery and its branches over here in this image on the left. So here goes our brachial artery running down the arm. As it enters the forearm in the cubital fossa, it is going to bifurcate into the ulnar and radial arteries. The radial artery comes more laterally, and you see that it does not have any main branches that we're worried about right at this moment. Whereas the ulnar artery is going to come down, and very soon is going to give off a major branch. Okay, so ulnar artery coming down medially, radial artery coming down laterally. The ulnar artery's main branch right here in this region is your common interosseous artery. So ulnar artery coming down, giving off the common interosseous. Common interosseous is then going to bifurcate into a posterior division. Posterior is right here, and an anterior division. The posterior division is diving through the interosseous membrane, which is why we see it disappear. So it dives through the interosseous membrane, and we see it disappear posteriorly. Anterior interosseous we can continue to see going down the forearm. Then the ulnar nerve is going to continue, ulnar artery is going to continue as we come down this way. Now you ask yourself, I see some vessels coming off the ulnar artery running back up. What could those possibly be? Well, because they're coming from the ulnar artery and running up, we're going to call these ulnar collateral arteries. You're going to have an anterior and a posterior ulnar collateral artery. So anterior ulnar collateral artery, recurrent. Anterior recurrent artery, posterior ulnar recurrent artery. The collateral arteries come from superior and run down, and they're going to join up with these vessels and anastomose. That will be your superior ulnar collateral artery comes down and joins with your posterior ulnar recurrent artery, going behind the medial epicondyle, running along with your ulnar nerve. And then your inferior ulnar collateral artery runs and joins with your anterior ulnar recurrent artery, running above the medial epicondyle. Okay, now the radial nerve is going to have one main branch that we do want to know, and it's not really shown well in this image, but let's imagine that there's a vessel that's coming off and running backwards and up. This is going to be your radial recurrent artery. We're going to look at the same thing over here on this image on the right. Brachial artery comes down, gives off the radial, which doesn't have any primary branches we're concerned with right this moment. Then we're going to have the ulnar artery. Ulnar artery is going to give off the common interosseous, which gives off the posterior interosseous, which dives through the interosseous membrane, and it gives off the anterior interosseous before the ulnar artery continues down towards the wrist. We can see here that we have the recurrence coming off of the ulnar artery, so we're going to have, once again, an anterior and posterior ulnar recurrent artery, and I believe right here might be a portion of that radial recurrent artery as it comes and wraps around back up to the arm. As far as nerves go, I want to point out the median nerve is coming down into the arm right here. It's going to come in beside the pronator teres and your brachial artery. So median nerve right here. Median nerve gives off a branch called the anterior interosseous nerve before it continues running down to the forearm. So there goes your anterior interosseous nerve there, innervating the deep muscles of the forearm. Okay, now the last two slides are going to be dealing with the wrist and the hand. So again, focusing on mostly nerves and vessels, not necessarily musculature. So over here, when you get into the wrist and the hand on the practical, I really want you to be approaching all the cadavers and be thinking thumb side or pinky side. Thumb side, pinky side. That's really how you want to be approaching this. So thumb side over here, that is going to be lateral. That is going to tell me this is the radial side. Pinky side is going to tell me ulnar side. So if this is the ulnar side and there is a nerve on the ulnar side, what do you know? That's the ulnar nerve. Okay, so really great way to approach these is find pinky and thumb and pair that with radial and ulnar sides. So the ulnar nerve coming here, we can see the ulnar artery right beside it. Notice that it is going above the flexor retinaculum, so it does not go through the carpal tunnel. Two muscles that we can see in this image that I want to point out is over here in the thenar compartment of the thumb. You're going to have the flexor pollicis brevis and the abductor pollicis brevis as well. These are both innervated by the recurrent branch of the median nerve. Okay, now looking deep into the hand, there's a couple of structures that aren't always seen great in labs, so I want to point them out here in case you're tested on them. The first is the adductor pollicis. The adductor pollicis has different striations for its two different components. Some striations are going to come straight across. That's the transverse head of the adductor pollicis, and some striations come up. That is the oblique head of the adductor pollicis. So transverse head and then the oblique head. Other structures that I want to point out here, we are going to have our abductor pollicis, our flexor pollicis brevis, and down beneath we can see our opponens pollicis. We can see the mirror muscles over here in the hypothenar compartment of the pinky as well. Vessels that I want to point out is the deep palmar arch. We can see that located here. The deep palmar arch gets this major contribution from the radial artery, but remember the ulnar artery also contributes to form the other half of the arch. Okay, and then lastly I want to point out this is the thumb side, so this is radial side. Pinky side must be over here, so the nerve that we see here must be the ulnar nerve, and this is specifically going to be the deep ulnar nerve. Alright, this is our last image for this review. I know it's been rapid fire, non-stop, but let's finish it up strong. This is a more superficial view. We can see our superficial palmar arch. We can see our deep ulnar nerve once again. And I want to point out here, as we've gone a little bit more distally, there's been dissection of a lot of the tendons and muscles in this region. So we're actually looking right here. These are the metacarpals. And this is the muscle. These are the muscles between the metacarpals. So if there's muscles between the metacarpals, these are going to be your interosseous muscles. So interosseous muscles indicated here between the metacarpals. Okay, so they're pretty deep. So be careful with that. And then I want to point out the branches of your arch. So this is your superficial palmar arch. That you can see part of your deep palmar arch just beneath it. Off of this arch, you're going to have common digital branches. Common palmar branches, so that happens while you're in the palms, and then those are eventually going to branch and go on either side of the fingers as proper digital branches. So while you're in the palm, it's common palmar, they're going to branch and go on either side of the finger as proper digital branches. Okay, that was a really rapid review of some of the high yield structures. Go back to the slide at the beginning if you want to see all structures you may be asked about on the practical. And then for any nerve, make sure that you are ready to rapid fire answer what spinal segments corresponding to the nerve and what muscles that nerve innervates. Make sure you know your spaces and your borders, your relationships between muscles and nerves, because that is often how things are tagged on the practical exam. I often find that the muscles are the easiest to identify, so that is why we focus on the vessels and nerves in this review. Okay, best of luck to you.